Hey, everybody out there in the whole entire world. It's this is Petdoc Donna, and I wanted to talk today about how I do triggers. So trigger diagnosis. I wasn't going to talk to you guys about how we treat for each trigger, but I was going to talk to you guys about triggers. And I know I'm a little bit early, so I'm hoping there's someone out there that has a few questions. So we're talking about immune-mediated diseases, and it's one of those it's kind of an epidemic in small animals, in dogs and cats. So these are conditions. I'm just going to kind of ramble on until somebody out there has a chat for me. Let me make sure I can get to the chats. Yeah, let me just click on that and make sure. Okay, I don't see anybody there. Okay, so let's just talk about what these are, because sometimes it's hard to recognize an immune-mediated disease in a dog or a cat because and even for the veterinary community, because they're not something that comes right to mind. So let's give an example of something that I've seen in the last couple months. We used to have fevers of unknown origin in cats. It was quite common. And maybe some of those were actually an infection from eating a wild bird and things like that. But for the most part, fevers that don't have an infectious cause is kind of, I would say this, it eludes veterinary medicine because we're always looking for a causative organism, because we've been taught really well to look for a virus, to look for a bacteria, to look for a causative reason why this pet would have a fever. Like, why would a pet have a fever if there was no infection? It doesn't even compute in our Western brain, in our Western trained brain. But in Eastern philosophy, and also in Ayurvedic philosophy, and homeopathic, and in TCM, all of these holistic ways of looking at the body do see an explanation for this. And so it can come with a trigger. So an animal could be triggered by a protein, by a specific amino acid. Amino acids are the building block of protein. So it could be triggered by, say, chicken or egg or beef or dairy products. And these are food-based allergies. And, you think, oh, it doesn't have an allergy, he just has a fever. And so it's true that the allergen has now become a trigger to the autoimmune disease or the immune-mediated disease. Does that make sense? So I use Nate. Was trained with Dr. Nambuta Proud. I was super lucky 20 years ago, and now she's retired. So it's a little bit now it's kind of an online training, whereas I went down to California 2 separate times and went through the human training. So, yeah, and I guess even more than that, I've spent all these decades learning how to muscle test. So that is how I find out what the triggers are. Does anybody have a question about that? Anybody at all? Or maybe even not a question, just kind of there. So we can have fevers that are immune mediated. And what's happened there is the reaction of the pet or the immune system has gone into the deepest place in the pet. In other words, it's not just up in the skin surface causing a skin allergy or even in the digestive tract causing diarrhea. It's actually deep within the body and causing a fever. So we can have other immune-mediated diseases. Maybe they're not fevers. They might come with fevers, but we could have the joints all swollen, very common in dogs, called polyarthritis. We could have nail bed disease, where the pet or the dog attacks its own nail beds, and now its toenails, its little nails fall out. And if that happens in a greyhound, it could be like the dog can't walk because all the nails fell out. It's very painful. And other immune-mediated diseases might be less commonly known, like hyper or hypothyroid in dogs and hyperthyroid in cats. And those are immune-mediated diseases. Most kidney disease in dogs or cats is immune-mediated. And so if I know that a pet has an immune-mediated disease, I'm going to be super careful about future triggers, right? So I'm going to be super careful about vaccinating that pet, or I'm going to be super careful about giving that pet a flea medicine. And I've seen certain flea medicines be huge triggers into different types of immune-mediated diseases. Yeah. So there's another immune-mediated disease where the dog attacks his own jaw muscles. It's called temporal myositis, or it's called MMM. And you're thinking, what the heck is that? And it's an immune-mediated disease. They've attacked their own their muscles, and then now they can't open or shut their mouths. So, I mean, a lot of these things, it sounds like you're making them up, right? But you're not, and this is kind of an epidemic now. So why are the pets now getting so many immune-mediated diseases? We used to say that it wouldn't be the old mutt in the back 40 that's not getting any medical care, that's not getting anything special. Those dogs would never get immune-mediated diseases. And now kind of some of them are, but for the most part, it's always going to be a purebred dog that's over-vaccinated, that the breeder insisted on vaccinating at a young age. And right now, pretty much like all the breeders are blaming, in a way, spays and neuters. So they're going, okay, we have all these immune-mediated diseases in sick dogs because of the spays and neuters doing it at an early age. So they're, in a sense, they're kind of blaming the veterinary industry, which is totally fine. I think the veterinary industry does cause a lot of problems, and they cure a lot of problems too. It's good to keep that balance, right? So we're not just like sort of blaming everyone. Anyway, and so I think hormone imbalances do cause some issues, but basically most vets, including holistic vets, don't understand these triggers. So whether the pet is spayed or neutered or intact, to me, it does not matter. I think I see immune-mediated diseases in all of those. It doesn't matter about if they're spayed or neutered or whatnot. But what are we doing differently? We are chemicalized. Our whole entire society is, has a high EMF load. We have a high chemical load. We do a ton of GMOs. And, people think it wouldn't be safe. If it weren't safe, it wouldn't be on the market. And that's just like not true, right? If it's, everything now is just litigated from the back end. So it could be unsafe, and until there's litigation, then there will be no change as far as regulation. That's kind of the American way for whatever reason. So I'm still looking for people. Is there anyone out there, anyone at all, that wants to join the chat? I kind of want to see, this is my very first, and also I should backtrack I'll talk more about immune-mediated diseases. It's like one of my favorite subjects, actually. Allergies, inflammatory bowel disease, immune-mediated disease. It's like the main thing I treat, and I just love treating it. But first of all, I want to talk about these podcasts. So I call this the positive revolution, and that is because it would be so great if you went to the vet, right, with your pet, for whatever problem that it has. And the vet thinks, I know a little bit about homeopathy or a little bit about herbs. And I feel like this case isn't bad enough yet to put them on high-level antibiotics or high-level immune suppressive therapy. I would love there to be another category. And that other category is safe, natural remedies. Safe, natural remedies for your dog or cat with minimal side effects and with low cost. So I'm really looking at wanting to kind of change the way things are at the vet when you go. And this unfortunately does fly in the face of corporate veterinary medicine, which says basically the minute you walk through that door, when you're in a high emotional state, right? You're most fearful about losing your pet. That's when people want to talk you into a $10,000 MRI or a $15,000 surgery. And sometimes it's good to just wait on those really expensive things. Sometimes those diagnostics are super important and really useful, and sometimes they're not. And I don't feel like there's enough voice out there to say, hey, this might not be something we need to jump right into. And this is something that we can take a deep breath, spend a couple days with some natural medicine, see if there's any other way to address this problem before we spend all this money. And in my opinion, a lot of times they don't get very far. And of course, I'm seeing a lot of cases where people spend all that money and then they end up at my office because they've exhausted all of those possibilities, So unfortunately, a lot of times that's when people don't have money to spend on good diets. And we're going to talk about that in a second. Do I see anyone? Is anyone there? I see two people, so I know someone's there. Does anybody want to jump down to the chat and say where you're from? Say where you're from and who you are. Hello? It's probably my dad or my mom. I always joke because if I see two people, even though they're divorced, my parents, if I see two people on my YouTube, I'm like, oh, look, there's mom and dad from different coasts. Anyway, so I wanted to talk about why I'm doing the podcast. And so that's why. And I also want to talk about who I'm going to be doing the podcast with. This is the only one where I'm going to be speaking myself, as far as I know, unless you guys want more of just me rambling on. But next, on Wednesday this week, I'm going to have Dr. Deb Mattis, who is a behaviorist. She's a dog trainer. She is a top level of TCVIM herbal training. So what she is going to talk to us about is behavioral management using herbal therapies. How cool is that? It means if your dog has anxiety or separation anxiety, if your dog has maybe any kind of behavioral problem that you want to work on, she's going to talk to us about some natural ways to work on those things. I see someone who says they're not my mom. Oh my God, you guys are so funny. We're going to have so much fun with these podcasts. Okay, so Wednesday at 3, that's Pacific time, I'm going to have Deb Mattis for an hour. Please join with your behavioral questions. And I'm going to go ahead and list all the other podcasts. Every week I have a different podcast. So I have Dr. Kim. She's president of the BBMA. She's going to talk to us about the top 5 herbs in cats and the top 5 herbs in dogs. How cool is that? She's a Western herbalist, which I just love. We have herbal medicine can come from both Chinese medicine, Ayurvedic medicine, and traditional Western herbal medicine and European medicine. It can come from literally all over the world. And it's amazing to see how many herbs cross cultures and cross countries. Very cool. So whoever you are, that's not my mom, if you have any questions, please send them. How does my audio and visual look, you guys? Am I coming across okay? And is there anything that you want me to speak about? That's what I really want to find out, because we struggled with the first I apologize to all of those that came. We had trouble audio and all kinds of visual problems because we didn't have the right upload speed with my last webinar or last podcast with Dr. Rob Silver. I'm putting up a podcast that I did with Rob a year or 2 ago on my Spotify and also on my Apple and also on my YouTube. It's great. It's on CBD and pain and pets, which is also something you're not going to hear generally at the regular vet. And it's great. A lot of these CBD and CBG products, they are, in my opinion, more effective than, say, gabapentin or your drugs for pain that are often prescribed. Let's see. Audio and video good. Okay, thank you. So we're talking about immune-mediated diseases. And what I'm saying is there's usually often a trigger or a set of triggers. A lot of times it's a food trigger. Sometimes it's a chemical or an environmental trigger. The reason that I love treating these cases with holistic medicine is because I get to put my detective clothes on, and I become a muscle testing super sleuth. At least that's how I think of myself. And those of you, if there's anyone there and that are my patients, I see 5 of you now. Thank you so much. If you guys want to chime in, that'd be super cool. So I treat allergies, I treat skin allergies, I treat digestive issues, and I treat immune-mediated diseases kind of all alike, no matter what it is, in a way, at least from a trigger point of view. When I'm trying to find the triggers, it doesn't matter to me what the physical manifestation of the disease is. It only matters that the animal is reacting. Their immune system thinks that piece of chicken or that piece of dust or that chemical glyphosate or Febreze, that's my worst one. Anyway, all of them could be triggers into this immune-mediated disease, and how sad it is that these pets then go to the vet and get suppressed because they have to, because they don't know another way to treat it. And maybe it's a life-saving procedure. I don't blame the vet community at all. But how sad it is that, the person doesn't know that. And so that's what I love to do. I love to put my sleuth hat on and find out. And like this week, I saw patients where it was like, yeah, we found out B vitamins were triggering a dog, found out that taurine was triggering a dog. And a lot of times we have just scratching from that. And then they'll scratch at their mouths, they'll chew at their feet. And those are often food allergies. But what I find is that the holistic veterinary community and the veterinary community does not recognize food allergies, especially. They think every allergy is an environmental allergy. And my opinion is there are often a combination. So you have foods triggering, and then you have environmental allergies triggering. So now you have a pet doesn't have a prayer of not having a reaction. It's amazing to me that so few do. even though it is this epidemic. Let's see, what else can I say? So we have food-based allergies, and I do the muscle testing for it. Does anybody have any questions about muscle testing? Does anyone not believe in it? I can tell you a quick story. I hope I don't ramble on forever for you guys. And that story is when I was first getting started with all this, I was an acupuncturist already, and a gal came in and she had her eczema. I'm talking about her. I treated her cat for eczema, and she got her eczema treated with a NATE practitioner that was across the city named Dr. Chulan Chong, and it was all clear. She had no eczema, and she said, "Do you know how we did this? We did this with something called NATE." And I was like, "Well, what is that?" And she's like, "Oh, we take the allergen, we muscle test it, I get acupuncture to help my body clear it, and then I'm better." And I'm like, okay, well, I will never do that. That is crazy. I can't even believe that muscle testing. Okay, that is quackadoodle. That's what I thought. And I mean, she was the nicest lady. She was like, "Okay, well, if you ever need to know who she is, here's her business card." And then a couple of years later, my own asthma kicked in so bad that like I almost had to go to the hospital. It was so bad. Anyway, long story long, I ended up going to that doctor myself. I went a lot. I had every food there was. I had every environmental trigger there was. I was allergic to animals. I was like, oh my gosh. And she helped me so much. And then that's when I started doing it for pets. And that was in the late 90s. And it's not something that most vets know how to do. It's not something that most holistic vets know how to do. But when we do the trigger testing, I basically have a kit where everything's in glass and I just line everything up. And I just do it with the client, and the pet is there. So basically the person has their hand on their pet. So they might hold a cat or whatnot. And then I use the other hand, and then I say, okay, we want to push real consistently. And then I do a bunch of tests to make sure that the muscle testing's working. So it's a long story. There's polarity tests and things like that. But anyway, I'm testing to make sure that this testing's working. Once I find out that the testing's working, then I start to introduce the allergens one at a time and see if I get a weakness. So the reason that it's really crazy, ooh, somebody's saying something. Guys, I just figured out. There you are. I just thought, just pushed a Dawn says, "We found muscle testing to be effective. It seems like a great place to start to test." And yeah, right. Why not test? Why not do muscle testing? I like at every vet clinic, right? It's Brandon. Hey, Brandon, but it's not your mom. No, Brandon, you're not my mom. That I know. Thanks, you guys. Anyway, where was I? So we basically figure out, and then I get a list. This is the list that triggers your pet. And then I say, okay, and the way I do it is we design a diet so we don't aggravate those triggers. And then now after I start treat, and then I treat each allergen. At that one appointment, I can only treat one allergen. Then I go on to the next week, we treat the next allergen. At the same time, then I do take into consideration the symptomatic picture when I pick a herbal therapy. So some herbs work more on the head and neck. They take away inflammation from this area. Other herbs are more in the blood, like of those fevers that I was talking about before, fever of unknown origin. It's really just a reaction, immune reaction to a chemical. The latest one here, and I don't know if Cheryl's on here. She said she might come. But basically, her dog, Gail, which is a border collie, 10 years old, started eating the new llama food. And the new llama food had a tocopherol acetate, which was corn derived. So once we figured out that the dog got corn allergies, was getting into the llama food, had this tocopherol or vitamin E allergen, now I have like a pathway into that immune system where we can clear it. First of all, we're going to stop the dog's going to stop having access to the triggers. But even with stopping the access, now that the immune system has been triggered inappropriately, to me, it's really important that you clear it. And even if that just means you're using immune acupuncture gates, which every acupuncturist can do. Large intestine 4, large intestine 11. Oops, can't get my foot up. Can I get my foot up? Oh, maybe. Okay. You guys, oh my God, you're going to think I'm crazy. Liver 3, it's between the big toe and the little toe. Spleen 6. So these are our important immune gates. But with the dogs and cats, the points change a little bit, and I can list those in the description if you're really interested in knowing. And it's a way of changing the immune system's response. So I didn't want to talk too much about actual treatment here, but so then there's herbs that clear blood from heat. So if there's too much heat in the blood, then it'll clear that. There's herbs that help more in the joints. And so anyway, wherever the inflammation is, I'm looking at an herbal therapy that will clear it. Well, they'll clear that inflammation. So I'm not talking about that old dog with arthritis that is basically like has bony B or old dog. I'm talking about a hot inflammatory situation. Usually the pet is not old. That's what's so weird about these new fever of unknown origin dogs. They're all older, whereas all these immune-mediated diseases always, all these decades, they've always been young dogs, sometimes under 1, always under 5, usually 2 or 3, and are they having a vaccine reaction? Are they having a flea medicine reaction? And then the body cross reacts with a chicken or cross reacts with a beef or a chemical that the dog is also exposed to. Anyway, I hope that clears it up. Let's see if there are any other questions that you guys, I see someone saying hi. Where are you guys from? Can you guys shout where you're from on the chat? I found out through Riverside, through this platform, that I can put your messages up on the chat, and I didn't know I could do that, but I guess I can. So I have to figure that out. If anyone knows how to do that, maybe they can let me know. And let me see if I can. Oops, I just got rid of the chat. This is like my very first. Oh, somebody said something about any herbs you can recommend for headaches. That would have to be, I'd have to know a lot more about that. And I feel bad. I'm not really allowed to make like human recommendations. But let's just say that you have a poodle that gets headaches. That I could talk about. So I got this poodle that gets headaches. Yeah. If they're not immune mediated, they don't really go with this talk, but you can get headaches from liver or gallbladder inflammation in a dog. I'm just going to talk about dogs. I'm a veterinarian. So that is a really common reason to get a headache. Okay, headaches for Sadie is what I'm seeing. Okay, I know Sadie. Sadie's an older dog. Why would she be getting headaches? So that's a perfect example. Maybe we have liver qi rising. Maybe we have gallbladder heat or stuck gallbladder energy. And that is a very common reason I know for human headaches. So is she drinking enough water? Is she getting her liver detoxified enough? And I would say with an older dog like that, I don't think it's wrong to detoxify the liver once a month, something like that. So ground dandelion greens, cilantro, parsley, burdock. So here we have a comment that she's on low dose naloxone. Oh my gosh, you guys, I cannot speak. She's on that. Okay. Yeah. It's helping with the pain. Okay. That's good. So she needs more liver detox. Yes. Yeah. That's the thing about the drugs. Like you have to weigh things, right? I want to do a pharmaceutical for a particular problem, but in my mind already as a holistic vet, I've already listed the side effects that could happen from that down the road, 6 months down the road, a year down the road. And I'm trying to stop them before they start. I'll give you guys an example, and maybe I'll even try to put some pictures when I edit this. I'm going to put some pictures of this stuff. So I had a King Charles Spaniel named Flossie, who was, I think, 13. But those dogs, almost all of them get mitral valve insufficiencies. And when I have a young King Charles that comes in for almost any reason, I'm basically starting them right away on heart stuff, herbs and supplements to help with the heart right out of the gate before there's ever a problem. They get a type of mitral valve insufficiency that comes on quick. Like 1 month you have no murmur, the next month you're in heart failure. I mean, it is crazy. So what happened with this dog was she went into heart failure, and she went to a cardiologist actually down in California. She flew with the dog down to, anyway. And the cardiologist said we can save her now, but she will only get 3 months because her kidneys will not be able to tolerate this high level of diuretics that we have to use to flush the fluid out of the lungs because she's in end stage heart failure. And, my client was like, yeah, well, what am I going to do? That's a good option. And she told me right away, and I said, we're going to work on those kidneys now. Why not work on the kidneys now? We know that the cardiologist told us that we're going to get kidney failure in 3 months. Let's start it. So I used herbs. I used nettle root. Anyway, I used an herbal combination for that dog. Let's see if I remember it all. Nettle root, foti root, hydrangea root, and there was one more that was really important. Oh, ashwagandha. I used an herbal combination in powder form with capsules, and then I also used a tincture that Herbalist Alchemist makes. It's called Kidney Support. And we did a number of different dietary changes and so forth. And that dog went almost 2 years on those hardcore diuretics. And I guess that's the power of holistic medicine that is not getting out there in the world. That's why we're doing these podcasts, because it was a preventative approach. It was like a last ditch type approach, but it made a huge difference for that dog. And I see Brendan's questions. Anybody else? Okay. I don't see many other questions. I'm trying to figure out how many people are even here, but I'm appreciative of everyone that is. You guys, I'm going to start doing these podcasts more, and I'm going to have a guest. So when we start, I see now that I can do the chats, and if everything's working okay, that was my main thing I wanted to get done today. Somebody says, if you need to use meds, use other things to help support the side effects, right? Like that was so good that cardiologist said that, right? Because as holistic vets, we don't usually get the privilege of being in that cardiology appointment. I wish we did. I wish that all of those big fancy clinics had a holistic vet there that could say, hey, we don't have to get all these terrible side effects. We already know they're going to come. Let's use slippery elm or marshmallow root for that diarrhea we know is going to come. Let's use dandelion greens and beet greens and milk thistle and, the dock family. All the docks help the liver, burdock, yellow dock. And we can do so much to help that liver failure. We can do so much for the kidneys, right? We can do asparagus, we can do parsley, we can detox with nettle root. And the kidneys, I think sometimes the liver gets a lot of attention and then the kidneys don't always get that much attention. And I think they both kind of need detoxification attention. Favorite detoxers, if you don't know what to do detoxing wise, is this product Vivo that I know I'm sort of plugging a product. I don't normally do that. My friend makes it and it's called Vivo Zeal Clear. And I'm telling you right now, like dogs will stop itching on it, and all it's doing is detoxing. It's doing it with zeolites and clay, and it's also doing it with quercetin, burdock. She's got like a lot of stuff in there, but for the cost, and especially if you don't know if you're doing the detoxing the kidneys or liver, I think it's an alternative that detoxes kind of the whole body. I know I don't normally plug things, but that's one thing that I think is helpful. Does anyone have any other questions on the chat? Oh my gosh, I'm so appreciative of all you guys. Really. Thanks, Brennan. Thanks, somebody who's not my mom. Thanks, everybody. And we'll do this again on Wednesday at 3. I hope you guys can join me. And Dr. Deb Mattis, who's who she is, but everybody should know who she is. She's got decades of experience. And, it's kind of like I wanted to have on my past podcast, I want to have people that I know that are making a huge difference that are in clinical practice. I don't really want people who are like not working anymore. You know what I mean? I mean, it's fine. We need that. We need those voices. But I want people who maybe you haven't heard of that are just doing tremendous work, but it's quiet. It's not on social media. It's, in a sense, I feel like they're the most authentic holistic vets that we have. And a lot of times they don't really care if they have a voice. I mean, and most of them I had to actually talk into doing it. So maybe you guys could tell your friends so that we have a lot of people here on Wednesday at 3, because maybe that'll mean Deb will come back, because I know she does an 8-hour training for vets on behavioral management using herbal therapies. And so she's going to boil it down for us in an hour. And it's super nice of her to do it. So anyway, you guys, I love you guys lots, and I hope to see you soon. And let me know if there's any subject or person that you'd love to have on the podcast. I would love, love, love your input. Thanks so much.